Should you stop getting pap smears? This is Dr. Rahman, and welcome to Black Women's Health Podcast. There have been a lot of talk about pap smears. Most women equate pap smears with a GYN exam. A lot of women feel as though if I don't get a pap smear, somebody's not doing their job. But we need to talk about this because things have evolved over time. Back in 1920, it was Dr. Papanicolaou who made the discovery
Realized and then
that
published.
you could detect abnormal cells from the cervix. And if you detected these abnormal cells and removed them, you would lower her probability of developing cervical cancer. So pap smears are screening tests to look for abnormal cells on the cervix, which is the opening to the uterus. This was a medical breakthrough. It's not a test for anything else. It's not a test for ovarian cancer. It's not a test for uterine fibroids. It's a screening test for abnormal cells that can develop on the cervix. And by 1940s,
it was easy to do.
By the
a relatively
1940s,
inexpensive
it was
test,
the standard
and by
of
the
care.
1950s,
A woman
it really was
understood that
standard
this
of
is
care.
what she needs to have as a screening test. It became our expectation and how we defined good GYN care. But things have changed. But before we talk about the changes, let's consider the following. No cancer is desirable.
And our goal
But when you
is
compare
to avoid
cervical
ever
cancer
having
to
hear this
something like
diagnosis.
breast cancer, you see that there is a huge difference in the number of cases that are diagnosed in a year and in the number of deaths, significantly less for cervical cancer. And so the question is, why do we talk so much about pap smears? Why is there so much discussion about it? Unlike so many cancers, particularly breast cancer, cervical cancer, dare I say it, is preventable. At least we believe it is preventable because we think we know what causes cervical cancer. And that is, first, she gets infected with a high-risk HPV virus. Getting infected with a high-risk HPV virus is not uncommon. HPV is sexually transmitted, and so it's not just who you're sleeping with, but who your partner or partners may have slept with that gave them or exposed them to the virus, and now you're with them and they're exposing you. So being sexually active is a risk factor for being exposed to high-risk HPV virus. Now that's the bad news. The good news is that this is a transient infection for the majority of us, meaning we get exposed to it, our immune system is healthy enough, it is contained, end of story. We worry about that woman who has persistent high-risk HPV, who doesn't clear it out of her system. We think for that woman, the virus will have sufficient time to get into the cells, induce abnormal changes, which over time will lead to
Could possibly lead
cervical
to
cells. So you have the
abnormal
HPV,
cells,
which can
cancer.
lead to abnormal cervical cells, which over time can lead to cervical cancer. The pap smear was focused on looking for abnormal cervical cells. The focus has now changed. We're now looking for exposure to high-risk HPV. if you look at the recommendations from the American Cancer Society, their recommendation is that a woman with a cervix doesn't need to start screening for high-risk HPV until she's 25, and that the test needs to be done every 5 years up to the age of 65. And assuming that she has had negative screening, she can stop after the age of 65. Now, this doesn't pertain to all women in all circumstances, which is why you need to know your history, your risk factors, and whether this recommendation is applicable to you. But things have changed. We're not so much focused on abnormal cervical cells. We're focused on that
You could say
precursor, that
there is a
exposure
focus
to
on the virus
HPV.
that causes
So the
the
best
abnormal
thing
cervical
is
cells.
to be proactive about your health. Understand that the recommendations are changing. Gone are the days when it's every year, beginning when she becomes sexually active. And because of that, depending on where you go and who you see, how they evaluate and monitor the situation may be different. Your provider may want to do a PAP and an HPV.
Recommendations
Another
may
provider may
change,
feel
but
comfortable
what
with just doing
doctors actually do in their
HPV
office
by itself.
may not
Some
change
places will allow
as
you to
fast.
collect your own HPV specimen for sampling. Things are changing. Stay tuned. I will share the news with you as we move forward. So, this is Dr. Rahman saying, take care and be well.